Welcome back. Now we're going to talk about the ideal position for your baby when your baby's head down. The back of the baby's head has a bone called the occiput. So there's a number of bones in our heads, but the occiput is an important marker or landmark for midwives and physicians for identifying what position the baby is in. So the most common position for babies to be in is for the occiput, the back of your baby's head, to be to the mom's left. And this is called LOT, left occiput transverse. The back of the baby's head to the mom's right is also another common position. And any position where the back of the baby's head is to the side of you or towards your front are all really good positions. So when your baby is in this position, from about maybe 32 weeks, but certainly 34 weeks on, it starts to get easier and easier to tell that, oh yes, this is my baby's back. You can kind of feel a flat area on this side, and then you'll notice that, yeah, I get a lot of the kicking kind of more on this other side. So it starts to get easier for a mom to figure out herself what position her baby is in. When the baby is in this position, back of the head to the front of the body, then all the kicking is into your back, not so many nerves in that area. And so it can often feel like maybe my baby isn't moving as much as I'm used to. But to just know that your baby's likely moving quite a lot, you're just not feeling it in the same way. And this is a very good position for babies to be in. So back of the baby to one hip or uppermost, any of these kinds of positions are excellent positions for birth. And when a baby's in a good position like this, you have rest periods in the labor, and then you have your contractions or your surges. These last about a minute, and then your rest periods are typically, if they're every 3 minutes in labor, then this would be a minute, and then the rest periods would be 2 minutes. And this makes for an easier birth for the mom because the rest periods are comfortable. And so this just goes a long way for an easier birth. If a baby's back of the baby's head is to the mom's back, then that makes for a very different kind of labor. So it's called a posterior presentation, where the back is to the mom's back, and it's just harder for babies to be born because it's a bigger diameter that's trying to get through the pelvis, and it's just not as easy as the other way of doing it. When the back is to the mom's back, this posterior presentation, often women will talk about back labor, where their back hurts. When a baby's in a good position, your back doesn't hurt, so you shouldn't notice any discomfort at all in your back in labor. So this makes more pain. So not only does it hurt in the back, but it hurts even more than a good position. And then instead of the rest periods being comfortable, these rest periods are very painful. And it can at least double the length of labor or even longer. So it makes for a very long labor, very, very painful, very difficult to handle, considered very normal, but not something that anybody would voluntarily sign up for. So you want to make sure your baby's in a really good position before going into labor, and encourage your baby to stay in that good position in labor. And one way to do that is, again, once your baby's head down. So if your baby's not quite head down yet, it's not a big deal, but from about 32 weeks, maybe 34 weeks or so, assuming your baby is head down, what you can do is you can pile up some pillows or have a physical therapy ball. You want to be leaning forward on the pillows or the ball. So you want your belly kind of hanging down. So as you're kind of, on all fours or scrubbing the floors, that kind of thing, you've got this kind of forward leaning position where the baby's encouraged to stay in that good position. So doing that forward leaning position once or twice a day, 15 minutes or so, should probably do the trick. If you take yoga classes, that kind of cat-cow when you're on all fours will also encourage your baby to be in a good position. When babies are in this position, it's probably because mom's kind of sitting back, you know, on a couch like this, and her knees are higher than her hips, and it just, our backs kind of create this nice hammock, and it's just comfortable for your baby to be like that. So from 34 weeks on, you want to be kind of sitting forward. You want uncross your knees, so no crossed legs, and then doing that leaning forward position, because when you go like this and then you go into all fours, that's just going to swing the back around and make it easier for your baby to be in a good position. So that's one really valuable tip for preventing back labor, and trust me, preventing back labor goes a long way for an easier birth. Thank you for sharing.